1 minute.
The gentlelady is recognized for 1 minute.
Thank you, Madam Speaker. I thank the gentleman for yielding, and I thank him for his leadership and that of Mr. Levin and Mr. Waxman as the chairs of the 3 committees when this legislation, so transformative in the lives of the American people, was passed by the House of Representatives. And now for coming to the floor today to, I don't know what the word is, to even counter some of the ridiculousness that is being said on the other side of the aisle in relationship to the Affordable Care Act. The fact is that what's happening today is the Patients' Rights Repeal Act. That's what they want to do, is repeal patients' rights. Why are they doing this? Do you think this would be a good idea to do this on Women's Health Month, to repeal legislation that gives a wide range of free preventive services to women, the protection being dropped for women when they are pregnant or when they are sick, that no longer will they, under the bill, no longer will they be charged higher premiums than men. Of course, the Republicans want to repeal that today in Women's Health Month, Health Week, that knowing soon being a woman will no longer be a pre-existing medical condition. That's just one piece of it. The fact is, this is not a serious effort to repeal the Act. That's not going to happen. What this is another example of job evasion, jobs evasion, in several ways. First of all, it is our job to come here and act for the good of the American people. And right now, the American people see that good as the creation of jobs. What is it, 134 days into this Congress, and the Republican majority has yet to put forth one bill and vote one bill out to create jobs, job evasion. Here we are today with yet another one of their subterfuges. Let's not talk about jobs. Let's use up time, and that adds to what has it been up until now, $54 million, 43-some days spent on this, the 37th effort to repeal the Affordable Care Act. What we should be doing is what the Republicans have asked for, regular order to go to the budget table to reconcile the differences between the House and the Senate so that we can put forth a product of budget that creates jobs, that reduces the deficit, that strengthens the middle class. Instead, we are wasting the taxpayers' dollars and time on legislation that is going to undermine protections for the American people when it comes to their health and well-being. This legislation, this bill today, just gives us another opportunity for our side to talk about the transformative nature of the Affordable Care Act. If there were no reason to pass such a bill, if everyone loved his or her own health care and health insurance premiums, if that were the case, we would still have had to pass the legislation because the status quo in health care in our country was unsustainable from a financial standpoint. It was unsustainable for families, for individuals, for families. It was unsustainable for small businesses. It was unsustainable for corporate America. The cost of health care was a competitiveness issue as we try to retain our position as #1 in the world. A competitive issue, a cost of health care, the rising health care. And it certainly was unsustainable for cities, states, and the federal government. Our budget could not sustain the rapid increase of health care to our budget. And so that's why, when the Speaker asked, the CBO responded by reiterating in a letter he sent yesterday. Yesterday, the nonpartisan Congressional Budget Office informed House Republicans in a letter that repealing the Affordable Care Act would increase the deficit by $109 billion over the next 10 years. They said that this was a figure they had given the Speaker last July. There may be some little changes in it between now and then, but that was approximately where the figures are. So if you want to reduce the deficit, you don't repeal the Affordable Care Act, because in doing so, you increase the deficit by $109 billion over the next 10 years. And the purpose of the bill was not only to make health care, improve the quality of health care, increase the accessibility to many more people, and to lower the cost, but that in lowering the cost, it would reduce the deficit. So it's a bill. Pretty soon, many more Americans will be taking advantage of it. But so far, over 100 million Americans have taken advantage of the preventative services. Over 100 million Americans. Over 100 million Americans are no longer subjected to lifetime limits on their insurance coverage. That's a remarkable thing. 6 million seniors have seen their prescription drug costs be reduced, those who are in the donut hole, by around $6 billion. Young people can stay on their, right now today, on their parents' insurance policy until they are 26 years old. The list goes on and on about the preventive exams that are free to seniors. The list goes on and on about what benefits the action that the Republicans are taking today would repeal that are good for the health and well-being of the American people. Now, this bill is not just about health care. It's about the good health of the American people. It's about prevention. It's about wellness. It's about electronic medical records that will change everything in terms of access to care and the quality of your care, because your records are wherever you are. It's entrepreneurial. Our founders, in their dedication, in their sacrifice, in their courage, called for life, liberty, and the pursuit of happiness as goals of our new republic, of our democracy. And this bill honors the vows of our founders in just that way. A healthier life, the liberty to pursue your happiness. If you're an artist, or if you're a photographer, if you're a writer, if you want to be self-employed, if you want to start a business, if you want to change jobs, whatever it is, you are no longer job locked because you can only go as fast in reaching your passion and your aspirations as your health insurance program will take you. If you have a child with a pre-existing medical condition, or if you're concerned about being sick yourself, you no longer are confined in your pursuit of happiness by the cost of a health care premium or the ability to even get one. It is entrepreneurial. We even see articles now, and Mr. Chairman, you have pointed them out in the public media, about young people, or not even young people, but people who want to leave companies and start their own businesses. They're waiting for this bill to be fully implemented so they have that freedom to go forth. So while I think it is a waste of the public's time to take this bill up on the floor of the House, to hear my colleagues talk on the floor, you think they either don't know what they're talking about or they do. And in either case, it is not the fact, they are not presenting the facts about what this legislation does. It is going to be right up there with Social Security and Medicare as pillars of economic and health security for the American people. It is going to make us more competitive internationally because our businesses will not have an anvil of the rising cost of health care. It reduces the deficit, improves the health and well-being of the American people. It's about the entrepreneurial spirit of America. It honors the vows of our founders of life, liberty, and the pursuit of happiness. This legislation should be rejected, and pretty soon more people, as they take advantage of the legislation, will see just how important it is to them individually and how important it is to the health and well-being of our country. With that, Madam Chair, I yield back the balance of my time.
The gentlelady yields back. The gentleman from California reserves. The gentleman from Tennessee is recognized.
Thank you, Madam Speaker. I now would like to yield 1 minute to Mr. Doug LaMoffala from California.
The gentleman is recognized for 1 minute. Where's he?
Thank you, Madam Speaker. I'm pleased to be able to join my colleague, Ms. Bachmann, on this legislation. We do have a history in the past of repealing bills such as prohibition. It has been done. So this one would have near the same status in size by the time it's all done. You know, I'm from California. We know a lot about boondoggles in California. I go back to high-speed rail and other issues like that. But they call this Affordable Care Act, and it's still being done with a straight face. Really. Price tag, we were advertised $900 billion. Now it's approaching $2 trillion. Jobs, 48% of business owners are saying that they're holding off on new hires because of the Obama health care takeover. Taxes, again, affordable, over $1 trillion in new taxes with more in sight. How are we calling this affordable? We've had 7 different measures to repeal portions of Obama health care takeover, with more on the way. And this part's really great. Thousands of new IRS enforcers will be hired to help implement Obamacare.
Gentleman's time has expired.
I ask you to support H.R. 45. Thank you.
Gentleman from Tennessee is recognized. Reserves.
I reserve the balance of my time.
Reserves the balance of his time. The gentleman from California is recognized.
I just have one speaker left. You'll close? Okay, thank you.
Gentleman from California.
I believe I have 1.5 minutes for
That is
Andrews.
correct. The gentleman from New Jersey is recognized for the remainder of the time. Without objection, the gentleman is recognized.
Madam Speaker, on the East Coast, it's almost the end of the workday, and we know that somewhere a mom who stood on her feet all day in a retail store or broken her back all day in a nursing home will come home and she will see that her son or her daughter isn't feeling very well, is too sick to eat dinner, can't seem to sleep through the night. Most of us in this country have the privilege of taking that child to the pediatrician or to the emergency room right away. Right away. But for over 40 million people in this country, they don't have that privilege, you see, because she'll hesitate. Because she'll think, well, maybe my daughter will get better by the morning. Because a trip to the emergency room for that family might also mean a trip to the bankruptcy court. We are here today to honor her work, not disrespect it. Almost every day here, the Wall Street bankers, the oil barons, the big shots get their way. Her day is coming on January 1st, 2014. Because for the first time in this country's history, we'll do more than talk about the fact that we honor her. We'll honor her work and honor her family with affordable health insurance. That day is coming. This charade won't stop it. No amount of misrepresentation will cease it. That day is coming. Her work will be honored. The Affordable Care Act will be implemented. I yield back.
The gentleman's time from California has expired. The gentleman from Tennessee is recognized.
Thank you, Madam Speaker, and I yield myself the balance of my time.
Without objection, the gentleman is recognized.
Madam Speaker, I came here 4.5 years ago in a bipartisan way to work on health care reform, which this country desperately needed. We've now had 3 years to look at the Affordable Care Act and found out, and I wish the bill had done as everyone had described here today. I wish it had done that. I wish that costs had gone down. I wish that businesses were hiring everybody because of this bill. I wish that taxes were not going up. But none of these are true. They are. And I wish that we had debated this bill in an open manner here by regular order, the Senate version of the bill, on this very floor of the House, which we did not. So I ask our insurance commissioner today in Tennessee, if we did not pass this bill, and you just heard me say early in the debate about premiums going up 50+%, I said if we did absolutely nothing, what would happen to rates in Tennessee? They would go up about 8 to 10%. We would be much better off in my state and around this country. And again, I came here in a bipartisan way not to work on a partisan bill, which is what this is, Madam Speaker, we need to repeal this bill and to replace it with patient-centered reforms that put patients and doctors back in charge of health care decisions. And with that, I yield back the balance of my time.
The gentleman yields back the balance of his time. Has expired. The gentleman from Michigan, Mr. Camp, and the gentleman from Michigan, Mr. Levin, will each control 20 minutes. The gentleman from Michigan, Mr. Camp, is recognized.
Thank you, Madam Speaker. I yield myself such time as I may consume.
The gentleman is recognized.
I rise today in support of H.R. 45, legislation to repeal Obamacare. In March of 2010, then Speaker Pelosi famously said with respect to the President's health care law, "We have to pass the bill so that you can find out what's in it." Well, Washington Democrats passed that bill, and virtually every week since has been an expensive, eye-opening experience. Over the past 3 years, it's become clear that Obamacare is irreparably flawed, fails to deliver on its promises, and causes serious harm to our economy. The legislation before the House is the first step toward fixing all of these problems. We must first repeal this onerous law and then move forward and work with stakeholders to develop step-by-step common-sense reforms that actually lower the cost of health care and respect the patient-doctor relationship. The President's health care law is at its core a flawed policy. It puts the federal government precisely where it doesn't belong, between Americans and their doctors. Instead of families deciding what coverage is best for them, or families and employers deciding how much they can afford, this law has the Secretary of Health and Human Services and the IRS making those decisions. Obamacare also falls short of almost every one of the President and congressional Democrats' promises for the law. It doesn't control costs, doesn't let Americans keep the insurance they have and like, doesn't protect jobs, doesn't ensure seniors have access to their doctors and hospitals, and doesn't prevent 21 new tax increases, including more than a dozen that will hit middle-class families. Simply put, it's a resounding failure. If that wasn't enough, the health care law is causing serious harm to our economy at a time when it's struggling to climb out of the hole dug by the administration's failed economic policies. We've received countless reports of businesses reluctant to hire or shifting employees from full-time to part-time employment because of the steep costs associated with complying with the law. This is simply unacceptable. Well over 11 million Americans remain unemployed. Madam Speaker, I urge my colleagues to join me in voting to repeal this burdensome law and continue working toward real reform that lowers costs and improves the quality of health care in this country. And I reserve the balance of my time.
The gentleman reserves the balance of his time. The gentleman from Michigan is recognized.
I yield myself such time as I shall consume.
Without objection.
I rise today in opposition to the Patients' Rights Repeal Act. Here we go again. This vote is more than just a sideshow. It's an embarrassing spectacle that has consumed House Republicans for more than 2 years, to the detriment of our economy and millions of Americans looking for work. Republicans on this have their legislative heads in the sand and their feet in cement. The Republicans are blind to the benefits that so many are already experiencing through ACA. It's already helping millions of Americans, with many millions more set to gain insurance coverage through the marketplaces next year. With their feet in cement, 37 times House Republicans will have voted to repeal all or part of Obamacare. More than 50 million taxpayer dollars have been spent by House Republicans through the dozens of hours Republicans have devoted to floor votes to try to repeal Obamacare, which even Speaker Boehner acknowledged last year is the law of the land. Since the beginning of 2011, Republicans have spent no less than 15% of their time on the House floor trying to repeal Obamacare when they know it would not happen. Yet not once this year, not once, have Republicans turned their focus toward job creation. What we have here, repeal, is a Republican obsession. I keep the balance of my time.
Gentleman reserves. The gentleman from Michigan is recognized.
At this time, I yield 1 minute to a distinguished member of the Ways and Means Committee, Dr. Bustani from Louisiana.
The gentleman from Louisiana is recognized for 1 minute.
Thank you, Madam Speaker. As a physician with 30 years experience, clinical experience, I rise to vigorously oppose Obamacare once again. That's what we need to repeal, this abomination. Why? Just take a look at this chart. Where's the doctor and where's the patient? Well, look at the corner. Physicians way here in the corner, patients way over there. What's at the center of this? The Department of Health and Human Services with the Secretary. And at the top, the IRS. And we all know what's going on with the IRS today. How can we trust an entity like that to enforce this abomination of a health law? Doctors and patients deal with very personal information. Very personal. That's why you have to preserve the sanctity of the doctor-patient relationship. And having all this between the doctor and the patient is basically a recipe for massive failure. That's why we must repeal it. That's why I stand with my colleagues to repeal it. Let's do the right thing. Let's go step by step and get sensible, real reforms that will make Americans proud of their health care system. Thank you. Now yield back.
Gentleman's time has expired. The gentleman reserves, and the gentleman from Michigan is recognized.
I now yield 1 minute to the gentleman from New York, Mr. Rangel.
The gentleman from New York is recognized for 1 minute.
I ask unanimous consent to revise and extend
Without
my remarks,
objection.
Madam Speaker. Thank you so much. I think all of us came to this august body with the mandate that we should try to improve the quality of life for our constituents and therefore the United States people that made our country so great. Education, health care, jobs. These are the things we want to do. But it's reached a point that this is no longer just putting Democrats in a political advantage. What it is doing is embarrassing the entire conference, the entire Congress. And I dare say people in the country recognize that there's something wrong going on in Congress. Now, those of you that have taken Civics 101 knows that there is no intention to repeal this act. People are waiting to get jobs. They're waiting, really, to get health care. And we're on the move for that. I've been here over 4 decades. And darn it, the devil, we've been trying to get universal care. We're almost there. Now, if you're talking about repeal, it takes the majority of both houses to pass this bill. The president is going to veto it. And you have to have 2/3 of both houses in order to repeal. That is not going to happen, and you know it.
The gentleman's time has expired. Gentleman from Michigan.
At this time, I yield 1 minute to a distinguished member of the Ways and Means Committee, the gentleman from Georgia, Dr. Price.
The gentleman is recognized.
Thank you, Madam Speaker, and I appreciate the Chair's leadership on this. This law has been in place now for a little over 3 years. So as a physician, let's look at the symptoms of this law. Cost of premiums, increasing. Access to your doctor or your plan, already more difficult. Quality of health care going down because of Washington interference. Innovation, terribly affected, harming quality in this country. Choices for patients, decreased. So let me get this straight. Increasing costs, less access, lower quality, less innovation, limiting your choices. Madam Speaker, that's a life-threatening and terminal diagnosis. It's time to repeal the ACA and adopt patient-centered health care where patients and families and doctors make medical decisions, not Washington and the IRS.
The gentleman yields back, and the gentleman from Michigan is recognized.
I now yield a minute and a half to the gentleman from Washington who's ranking on the House Subcommittee, Mr. McDermott. Dr. McDermott.
The gentleman is recognized for 1.5 minutes. Without objection. The gentleman is recognized.
Well, Madam Speaker, it's Thursday. Everybody's going home. Got to have your press release ready. So here we come. 37th time they're going to try and repeal the Affordable Care Act. Now, you've heard a lot of nonsense already in two speakers. Absolute untruths told right here about killing jobs and about rising premiums. Washington State put out their premiums yesterday, and their premiums for young people are down by 15%. All that hyperbole about going up 450% or whatever we hear is nonsense. It is simply fear-mongering, and, you know, the deficit comes down, insurance is more affordable and accessible, and at the most, 33% have been convinced by this stuff over here. In my home state, people are ready and willing to do it. Our governor went out and set it up, and we're going to go and do it. Now, the only thing the Republicans are angry about is that Obamacare is going to become the law. It's being implemented. It's going to be in place in October. It drives them nuts that they can't figure a way to stop it. They come out here once a month to try and repeal it over and over and over again, and they keep failing. That's pretty close to the definition of mental illness, doing the same thing over and over again and thinking you're going to get a different result. You are not going to get a different result. The fact is that this is about votes. We have a new crop of freshmen who are getting their campaigns ready, and they got to have that check in the box that says, I voted against Obamacare.
Gentleman's time has expired.
Vote no.
The gentleman from Michigan is recognized.
Thank you, Madam Chair. I yield 1 minute to a distinguished member of the Ways and Means Committee, the gentlewoman from Tennessee, Ms. Black.
The gentlewoman is recognized for 1 minute.
Thank you, Madam Speaker, and thank the gentleman for yielding. I stand here today outraged by the fact that the Internal Revenue Service has been targeting conservative groups since as early as 2010. This is not a Republican or a Democrat issue. This is a First Amendment issue, one that should be a wake-up call about the dangers of the new expansive powers afforded to the IRS under Obamacare. No government agency, particularly one with such corruption and apparent disregard for the Constitution as the IRS, has any business accessing or monitoring Americans' personal health information. And as I speak here today, government bureaucrats are building the Federal Data Services Hub, the largest personal information database ever created by the U.S. government. And because of Obamacare, 5 major government agencies are compiling information for the Data Hub, including the IRS, HHS, Department of Justice, Department of Homeland Security, and Social Security Administration. And what this hub means is government bureaucrats are gaining unprecedented access and power over the American people's financial health, personal information through the implementation of Obamacare.
Gentlelady's time has expired.
Mr. Chairman, may I have 30 seconds?
An additional 30 seconds.
The gentlelady is recognized for 30 seconds.
The IRS scandal begs the question, how can President Obama and the congressional Democrats continue to support Obamacare, a law that gives more power to the IRS? Ultimately, the IRS scandal is yet another example of why Obamacare must be repealed for the sake of our health care, our economy, and our constitutional freedoms. Thank you, and I yield back the balance of my time.
The gentlelady yields back. The gentleman from Michigan is recognized.
I now yield 1 minute to the gentleman from Massachusetts, a distinguished member of our committee, Mr. Neal.
Without objection, the gentleman is recognized for 1 minute.
Speaker, today I rise in opposition to the repeal of the Patients' Rights Act. 71 million Americans have already taken advantage of this opportunity for preventive health care services. 100 million Americans no longer will have a lifetime limit on their health insurance program. Young adults can stay on their parents' health insurance until they're 26. 98% of the people of Massachusetts are insured. The number regularly polls in the high 70s for customer satisfaction. Let me just say this. with some degree of certainty. The best hospitals in the world are in Massachusetts. Arguably the best doctors in the world are in Massachusetts. Certainly the best teaching hospitals in the world are in Massachusetts. They've made it work. People are happy with the plan. If you're going to get sick, I say this to my Republican friends as well, I'm going to get you a spot in Massachusetts. Here's the point that we ought to be discussing today, the implementation of this successful plan. And you know, I want to say this today tongue-in-cheek, but also with some satisfaction. We should thank Governor Romney for working with a Democratic legislature to make sure that the model for the Affordable Care Act was in place. Let me say that again. Thank Governor Romney for helping to make sure this plan was successful.
The gentleman's time has expired. The gentleman from Michigan is recognized.
Thank you. I yield 1 minute to a distinguished member of the Ways and Means Committee, the gentleman from Indiana, Mr. Young.
The gentleman from Indiana is recognized for 1 minute.
Madam Speaker, when Obamacare was being debated, its champions and cheerleaders indicated it would create 4 million jobs, including 400,000 jobs almost immediately. I find it deeply disturbing then that when I travel back to my district in Indiana, I hear from constituents that jobs are already being lost and hours being cut in anticipation of this law's implementation. I've heard from numerous constituents who work low-wage hourly jobs, like school support employees, cafeteria workers, janitors, bus drivers, and so on. They're being told that due to Obamacare's employer mandate, they'll no longer be allowed to work more than 29 hours a week. Obamacare's proponents have created an incredibly perverse incentive here. Who in their right mind endorses a law where the best business decision is to lay people off, and during a very down economy to boot? If we're serious about addressing rising health care costs and putting Americans back to work, we should repeal this law and repeal it now and replace it with sustainable, bipartisan health care solutions. Thank you. I yield back.
The gentleman's time has expired. The gentleman from Michigan is recognized.
I now yield 1 minute to another member of our committee, the distinguished gentleman from the state of Connecticut, Mr. Larson.
The gentleman is recognized for 1 minute.
Permission to revise and extend my remarks?
Without objection.
I have an idea. What if the Heritage Foundation had an idea to reform our entire health care system? Even better, as Mr. Neal says, what if that idea was piloted successfully by a Republican governor in a Democratic state who would go on to become their nominee for president? What if that idea were brought to fruition nationally through the Affordable Health Care Act so it could provide American citizens, especially the uninsured and those with pre-existing conditions, to become the focus of our energy and concern in Washington? An emphasis on wellness by seeking to enhance the best in the private sector, the best in the academic sector, and the public health initiatives that have guided this great country of ours. What if we do what the American people expect us to do, instead of quibbling over partisan issues, rolling up our sleeves and coming together for a solution to the American people?
The gentleman is recognized for an additional 30 seconds.
Coming together instead of quibbling over the Affordable Care Act, rolling up our sleeves and putting the nation to work. Every day we waste in ideological turmoil is another day lost to the opportunity to help the American people, and the key, as Mr. Ryan states, to driving down our national debt. Come together with us, Republicans. Solve this issue for America.
The gentleman's time has expired. The gentleman from Michigan is recognized.
At this time, I yield 1 minute to the distinguished gentleman from Georgia, Mr. Graves.
The gentleman from Georgia is recognized for 1 minute.
Madam Speaker, I rise today to say it is time to pull Obamacare out root by root. We all know that it increases premiums and squeezes the family budget. We know that it does not let you keep the plan that you have today. We all know that Obamacare is crushing jobs and forcing many parents who have full-time jobs today into tomorrow's part-time jobs. And now we have some new information as we prepare to vote. The chief enforcers of this law, the IRS, have been outed as partisan political operatives. They've harassed and bullied and suppressed the political opponents of the Obama administration, and now they want to be in charge of our health care? Give me a break. I don't think so. Members, this is your chance. This is your chance to weigh in on the IRS scandal. A vote to repeal is a vote to stop the IRS. But voting to keep Obamacare is a vote to empower the IRS as the health care police of the United States. The choice is easy. Vote to take power away from the IRS,
Gentleman's
not
time
to give them more.
has expired. Gentleman from Michigan.
I yield 2 minutes to the gentleman from Texas, Mr. Doggett.
The gentleman from Texas
Member of
is
our
recognized for 2 minutes.
Thank you. Mr. Speaker, I rise today in opposition to the Patients' Rights Repeal Act. Like a broken record repeating the same old scratchy, sad verse, these Republicans cannot stop repeating their record of indifference to the health care crisis. They've given up on repeal and replace because all they ever cared about was the repeal part. As the party of no, this year they have not advanced a single health care proposal as an alternative. I only wish that the Affordable Health Care Act were as good as they think it is bad. But to the millions who have received refunds from insurance company monopolies for overcharging, to the millions who are no longer denied coverage by the fine print in an insurance policy they didn't write, to the seniors who are getting some help on their prescription drugs and preventive care, to the millions more who will be able to finally apply in October for coverage they do not have now, for the small businesses who will receive assistance in supplying their employees with the coverage they have been unable to afford in the past. You know, this Obamacare, it works pretty well. Together, we could make it better. We can make it more accessible for more individuals, like the many people in Texas who will be denied by Governor Perry's decision to refuse 100% of the cost of Medicaid protection. Together, we could provide more cost-effective care and do something more about spiraling health care costs. But really, the only true Republican alternative to Obamacare is nothing care. I yield back.
The gentleman yields back. The gentleman from Michigan is recognized.
Thank you. I yield 1 minute to the distinguished gentleman from Michigan, Dr. Beneshek.
The gentleman from Michigan is recognized for 1 minute.
Thank you. I ask unanimous consent to revise.
Without objection.
Madam Speaker, I rise today to urge support of H.R. 45, legislation that will repeal the President's massive and unaffordable health care law. As a doctor, I'm extremely concerned with many different aspects of the bill, which is broad and overreaching. When this law was passed, I was in northern Michigan treating patients and wondering how this bill would change the relationship between doctor and his patients. I can tell you that from my 30 years of experience, and after continuing to speak with doctors, nurses, hospital administrators, and patients across northern Michigan, there are innumerable problems with the law, and it needs to be repealed. Thanks to Obamacare, we will face severe problems with access to quality health care. We are looking at massive cuts to reimbursements to hospitals and other care providers, cuts that will end up limiting access to care. Obamacare does not fulfill the most basic promises that were used to pass this law. Health care costs have not gone down. My constituents are not able to keep their plans. These are just some of the reasons why I urge all my colleagues to support this bill so we can work together to provide patient-centered reform that will reduce costs and expand access.
Gentleman from Michigan.
I now yield 2 minutes to another member of our committee, the distinguished gentleman from New Jersey, Mr. Pasquale.
The gentleman from New Jersey is recognized for 2 minutes.
Madam Speaker, I rise today in opposition and in support of the Patients' Rights Repeal Act. Madam Chair, you know, we've gone through this many times. You've attempted in committee, subcommittee to try to undercut the patient's rights to health care, and it wasn't successful. By the way, IRS is not the individual agency that is the operative of health care. Where in God's name did you get that from? There hasn't been much truth spoken today on the floor over there. Whether in town halls or small group meetings, I ask this question when we talk about health care. I ask individuals to raise their hands if they're against, number one, you better raise your hands too, closing the Medicare donut hole for seniors. Are you for that or are you against it? Allowing children to stay on a family's health plan until they're 26 years of age. Are you for that or are you against it? Ensuring Americans are not denied insurance for pre-existing conditions. Are you for that or are you against that? Or helping American families avoid medical bankruptcy. Every meeting, not one hand goes up. How many over there? Raise your hand. Free country. I'll wait 2 seconds. Maybe you didn't hear me. In New Jersey, a report by the New Jersey Public Interest Research Group explained by repealing health reform, employers would see health costs grow by more than $3,000 a year. And most shocking, New Jersey would have 10,000 fewer jobs. Let's get it straight. In conclusion, let me ask my colleagues in voting, those who will vote for repeal, is the opposition willing to increase the deficit? Because you already used the money from the Health Care Act to pay your budget, or else it doesn't even balance in 50 years. Are they willing to give the power back to the insurance companies? You've got to ask that question. We've come down to the skivvy right now. This is
The
down to the
gentleman's
bare bones.
time
And are you
has
willing
expired.
to allow premiums to escalate? I'd better ask yourself
And the
those
chair
questions.
would like to remind the members to address your statements
Through
to
the
the
chair.
chair and not to folks in the second person. The gentleman from Michigan is recognized.
I thank the chair and I yield 1 minute to the distinguished gentleman from Florida, Mr. Radel.
The gentleman from Florida is recognized for 1 minute.
Heavy-handed government has been chipping away at our freedom and your opportunity for generations, whether it's big government Democrat programs or to be bipartisan big government Republican programs. That brings us to this debate today on the Affordable Health Care Act, which is not affordable, and it is not about health care. It's about control. Your freedom, your choices between you and your doctor, no longer between you and your doctor. Someone from right here in D.C., in some way, shape, or form, will be involved in your most personal decisions. Freedom and opportunity. The freedom to choose insurers, insurance, and your doctor in a truly free market now gone. This repeal is about your opportunity, which Obamacare is already taking away from you. I want you to have a job. I want you to work more than 39 hours a week. This repeal is about your freedom. I want you to keep more money in your pocket. I want you to have low premiums. I want you to have a choice. Your choice, not Washington, D.C.'s. This Affordable Health Care Act is not affordable, and it is not about health care. It's about control. Thank you, Madam Speaker.
Gentleman's time has expired. Once again, the chair reminds the members to address your concerns to the chair. The gentleman from Michigan
Madam
is
Speaker,
recognized.
how much time is there on each side?
The gentleman from Michigan has 9 minutes remaining, and the other gentleman from Michigan has 10.5 minutes remaining.
I yield 2 minutes to the gentleman from New York, Mr. Crowley.
The gentleman is recognized.
Mr. Speaker, I rise today in opposition to the Patients' Rights Appeal Act. We've heard a lot about the fact that this is the 37th vote to take away health care from hardworking Americans. But let me put that in context. Under the Republican majority, we have spent over 56 hours on the floor debating repeal of the law of the land, and that doesn't even come close to capturing how much committee time, amendment time, and debate, and general grandstanding that has been spent on this bill. Now, it is tempting, but I'm going to avoid illustrating this point with comparisons like telling you how many times you could have watched Gone with the Wind in that same amount of time. Although, as a matter of fact, you could have watched it 15 times. What I want to talk about is what else we could have done with that 56 hours of Congress's time and energy. We could have acted on a real jobs plan to get our economy moving. We could have come together on a plan to avert the devastating sequester cuts that are hitting our Head Start programs, our cancer patients, and our military, just to name a few. We could have moved forward on immigration reform, gun violence prevention, or infrastructure development, but we haven't. Now, my colleagues on the Republican side of the aisle have been using a chart, an incomprehensible chart, something that no American can understand, to try to demonstrate how the Affordable Care Act works. Well, it just so happens I have a chart right here. This is the Republican plan to deal with the absence of the Affordable Care Act. It's right here. This is the chart. This is the chart right here. I'll try to explain it to you. Well, in fact, it's self-explanatory. They have no plan. They have no plan to substitute the repeal of the Affordable Care Act. In fact, they haven't a plan for health care at all. So my colleagues, I just wish my colleagues on the other side of the aisle would spend as much time building America up as they've tried to tear it down. Frankly, my colleagues, I do give a darn.
Gentleman's time has expired. The gentleman from Michigan is recognized.
Thank you. I yield 1 minute to the distinguished gentleman from Ohio, Dr. Wenstrup.
The gentleman is recognized for 1 minute.
Thank you, Madam Chair. I rise today in support of H.R. 45 to repeal Obamacare. Madam Speaker, as a physician, I know our health care system is broken, but this form of Washington meddling only makes it worse. The President's law puts too much control in the hands of the federal government, creating a complex system that emphasizes government intrusion over actual patient care. There is no reason for the IRS to play a role in our health care system, favoring one and punishing another. Medical decisions already cause deep anxiety in the lives of too many Americans. Why compound that with the weight of an audit? Our goal should be simple: respect you as a patient and connect you to the doctor that you deserve. Patient-centered solutions place you, the patient, at the center of our health care system, simplifying your life, not pushing you to the corner of big government sprawl. Madam Speaker, the American people deserve full repeal. I yield back my time.
Gentleman yields back. The gentleman from Michigan is recognized.
I now yield 2 minutes to another member of our committee, the gentleman from Illinois, Mr. Davis.
The gentleman from Illinois is recognized for 2 minutes.
Thank you, Madam Speaker. Madam Speaker, I rise today in opposition to the Patient Rights Repeal Act. And as some of my colleagues on the other side prepared to vote in favor of this legislation, I want to make sure that the American people know that they are taking 13 million Americans' rebates that they got from insurance companies last summer, totaling at least $1.1 million. They will be voting to repudiate the fact that beginning last summer, millions of women began receiving free coverage for preventive services. They will be voting to take away the fact that 17 million children with pre-existing conditions can no longer be denied coverage by insurers. And they will be voting to take away the coverage of 6.6 million young adults who up to age 26 are able to be on their parents' insurance coverage, half of whom without it would have no coverage at all. They will actually be voting, Madam Speaker, to take Americans' health care backwards. We can't afford to go there. I urge that we vote no and yield back the balance of my time.
The gentleman yields back the balance of his time. The gentleman from Michigan is recognized.
Madam Speaker, at this time I yield to the distinguished chairman of the Health Subcommittee for the purposes of controlling the balance of our time.
The gentleman from Texas is recognized.
Thank you, Madam Speaker. I yield 1.5 minutes to a new leader in health care, the gentleman from Florida, Mr. Yoho.
The gentleman from Florida is recognized.
Madam Speaker, I stand today to show my support for the H.R. 45, the repeal of the largest legislative piece of malpractice ever passed through the halls of Congress. This one bill, the Affordable Patient Protection Care Act, Obamacare, has done more to disrupt our economy and bring uncertainty to the marketplace than anything I have witnessed. My colleagues on the other side talk about jobs and no job creation on this side. We are working to create jobs here by repealing this bill. This is the #1 job-killing bill in America, and it has rocked the engine that drives our economy, the business owner and the entrepreneur that create the jobs. Without jobs being created, the hardworking Americans will lose their jobs, and they're going to lose their health care. Instead of health care reform, Congress created a health care tax, and it's a tax that will be paid by all Americans, young, old, rich, or poor. Today, in response to the people who have had enough, the White House declared this: it's, period, the period, law, period. My response on behalf of the people I represent is this: not for long. Madam Speaker, I yield back.
The gentleman yields back the balance of his time. The gentleman from Michigan is recognized.
I now yield 2 minutes to another distinguished member of our committee, Mr. Blumenauer, from the state of Oregon.
The gentleman from Oregon is recognized for 2 minutes.
Thank you, Madam Speaker. This is, as has been pointed out, the 37th attempt to repeal the health care reform. It's been my privilege to run 37 marathons in my career, but at least when you run a marathon, you get someplace. Millions of people are benefiting from the health care reform. Over 1/3 of a million small businesses are getting tax credit to be able to help insure their employees. We're seeing aggressive efforts at better care, lower cost, eliminating lifetime limits, keeping young people on their parents' insurance policies. Madam Speaker, we're finding across America there are literally hundreds of thousands of people working on the implementation of this legislation. Is it perfect? Haven't seen a perfect bill, especially one that's dealing with 17% of our economy. But it is a dramatic improvement over what we've got. But instead of working with us to refine and improve over the course of the last 4 years, we go through these pointless exercise without offering an alternative. My friend, my colleague from New York, Mr. Crowley, had their plan, a blank piece of poster board. No specifics, no effort to come forward with something that would do a better job of meeting the needs of seniors' prescription drug problems, young people, patient protection, lifetime limits, payment reform. I'll tell you, in Oregon, I have met with thousands of professionals in the health care arena who are working cooperatively on making sure that Oregon is a model of how to do it right. The health care reform train has left the station. We're not going to be repealing it today. We ought to be working to refine it in the future.
Has expired. The gentleman from Texas is recognized.
You know, I yield 1.5 minutes to a new member of the Ways and Means Committee, a job creator, businessman himself who's had to deal with rising health care costs, the gentleman from Pennsylvania, Mr. Kelly.
Right,
the gentleman is recognized for 1.5 minutes.
I thank the Chairman, Madam Chair. It's interesting to hear, as we go through this tonight, about just how important and how great a piece of legislation this is. I got to tell you, there's an old saying out there, of all the words of mouth and pen, the saddest are what could have been. This could have been a miraculous piece of legislation. Wouldn't it have been wonderful if both sides of the aisle had been able to work on it? Wouldn't it have been wonderful to have some debate, some amendment on it? Wouldn't it have been wonderful not to have to wait till midnight and shove it down the American people's throat? And wouldn't it have been wonderful for guys like me who have small businesses to be actually able to look at this and think to the future that, you know, I can actually plan. Obamacare is making this nation sick. It's having a terrible effect on our economy. It keeps people from hiring. But you know what it does? That's the worst thing of all. It drives a wedge between business owners and business operators and their employees and their associates. That's the biggest problem. We're trying to make those people, the owners, the managers of the business, the bad guys. Listen, the bad guy in this case is the United States government. We have done something that is absolutely irreprehensible. You cannot do that to people who make a living working with each other and then put them on opposite sides of a case. Better health care? Absolutely. Affordable? Accessible? Absolutely. This piece of legislation did not do that.
And I am intrigued by the amount of passion that we see now from the other side when there was so little concern at the time it was crafted to even bring the providers to the table and ask their opinion. You talk about not having a piece of legislation ready? It's law. We know it's law. But you know what? We're not going to quit trying till we go to the will of the American people. I would tell you all, please go out into your constituents. Go after the people who actually create the jobs and find out how difficult we've made it for them with this piece of legislation.
Gentleman's time
I thank you, and I yield back.
has expired. Gentleman from Michigan.
How much time on each side, please?
The gentleman from Michigan has 3.5 minutes remaining. Gentleman from Texas has 6 3/4 minutes remaining.
I reserve.
The gentleman reserves. The gentleman from Texas is recognized.
Madam Speaker, I yield 2 minutes to a gentleman from Alabama, former district attorney, state legislator, county commissioner, understands how communities struggle with health care, Mr. Brooks.
The gentleman is recognized.
Mr. Speaker, I rise to proudly vote to repeal Obamacare, the most dysfunctional law to ever pass the United States Congress. Why is Obamacare dysfunctional? For the vast majority of Americans, Obamacare guarantees worse health care at higher costs. Why is Obamacare dysfunctional? Obamacare imposes 21 new taxes on America, thereby, according to the Congressional Budget Office, costing 800,000 Americans to lose their jobs. In my home state of Alabama, just one of those tax increases imposes roughly $200 million a year in higher tax burdens on Blue Cross Blue Shield, costs that will translate into higher premiums for Alabama citizens. Why is Obamacare dysfunctional? Those 21 tax increases come nowhere close to paying for the increases in Obamacare costs, thereby either denying health care to American citizens or forcing even higher taxes on already stressed family incomes. Why is Obamacare dysfunctional? It gives Americans worse health care. Doctors and patients will largely be shut out of costly, life-saving health care decisions. Instead, independent payment advisory board bureaucrats will decide whether Obamacare will pay for the treatments that save your life or risk ending it. Why is Obamacare dysfunctional? It suppresses the research and development necessary for the discovery of the next generation of life-saving diagnostic tools and medical cures. Why is Obamacare dysfunctional? It drastically drives up health insurance premiums for Americans who work for a living. Mr. Speaker, while my friends across the aisle bemoan today's vote to protect Americans from a dysfunctional Obamacare, I rejoice that Republicans in the House of Representatives say that when American lives are at stake, we will never give up and we will never, never surrender.
Gentleman yields back the balance of his time. The gentleman from Michigan is recognized. The gentleman reserves. The gentleman from Texas.
This time, Madam Speaker, I yield 1 minute to a long distinguished member of this House, and again, very knowledgeable about health care and the costs to families and businesses, the gentleman from Georgia, Mr. Kingston.
The gentleman from Georgia is recognized for 1 minute.
I thank the gentleman for yielding and want to say my role as chairman of the Health and Human Services Subcommittee of Appropriations, we oversee the budget for Obamacare. And I can tell you the money is not there even for implementation. The request was for $1.2 billion, and now it's accelerated up to $1.7 billion, and there's no funding for it available. And so here we are on the eve of the largest takeover of a private sector function in the United States history, and the money's not there to implement it. And so what does the Secretary of HHS do but goes to the private sector and says, we need to get money from you to implement Obamacare. Now that is like the mafia shaking down businesses for protection money. And I'm not saying that at all that the Secretary would be trying to do that purposely, but it is similar to it. How can you ask people that you regulate for money to implement a program that they're going to fall under? That just is repugnant to any American, and we can't let that happen. The money is not there. We need to vote no and send this thing back to committee and look at it another day and another way.
Gentleman's time has expired. Gentleman from Michigan.
I now yield 1 minute to Ms. Jackson Lee of Texas. 1 minute.
The gentlelady from Texas is recognized for 1 minute.
Madam Speaker, I rise today in opposition to the Patients' Right Repeal Act. I thank the gentleman for his time, and I simply want to say thanks. My good friend, Mr. Crowley, indicated that there is no plan on the other side, but look at the list that I can give. But let me just emphasize Texas for the gentleman from the business community. 360,000 small businesses are using the health care tax credit that is provided by the health insurance under the Affordable Care Act for its workers. 17 million children with pre-existing conditions in Texas no longer can be denied coverage by insurers. And then, of course, what we're finding out is those who treat those with cancer are suffering because there are cuts in Medicare. Those cuts in Medicare are coming because of my friends on the other side. But the Affordable Care Act will provide an umbrella for those who are in need. Then we find out that Texas itself has 3.4 million women and over 1.8 million seniors and people with disabilities who are benefiting from the Affordable Care Act. But more importantly, we have articles that suggest that the poverty in Texas is going up, and Texas has the highest uninsured people in the state, in the nation. How can people from Texas vote against this?
Has expired.
How can they
The gentlelady's time has expired. The gentleman from Texas is recognized.
Madam Speaker, I'm honored to yield 1 minute to the author of the legislation that we are debating today, the gentlelady from Minnesota, Ms. Bachmann.
The gentlelady from Minnesota is recognized for 1 minute.
Thank you, Mr. Speaker. Thank you also to the gentleman from Texas. This is a bill that is changing the course of American history, and it is why we need to repeal this bill today. I believe, Madam Speaker, that we will see this bill ultimately repealed.